and kind of finish up with this, we will talk about hernias and the assessment of hernias. So let me get back to the PowerPoint and show you what I mean. Oops, wrong PowerPoint. There we go. Okay, so what you'll see is a bulging, okay? Strangulated or incarcerated hernia is a complication you need to be aware of. What does that mean? It doesn't mean that the hernia went to jail because it was incarcerated. It means that when the part of the organ, usually the bowel, protrudes through the muscular wall, it twists in such a way that it cuts off the blood flow. When that happens, it is not reducible. In other words, you can't push it back in because it's twisted, and that's an emergency. That needs to be addressed immediately because blood flow is cut off to that part of the bowel. The patient is going to wind up with an ostomy, unfortunately, if that's not addressed immediately. It needs to be relieved and blood flow needs to be restored to that area. If it's reducible just means that with your hand, you can actually take it and push it back in where it came from. Truth. I know that sounds crazy, but you can take it, whether it's testicular, abdominal, umbilical, whatever. Where that bulging is, when you push it, you can push it back through the muscular wall and back from whence it came. That's not an emergency, okay? So make sure you know that. And that's enough with hernias. That's all you need to know. Let's move along real quickly. Celiac disease and lactose intolerance. I'm going to make this one short and sweet. If you have celiac disease, you will know it from when you are a child. You don't wake up one morning at the age of 42 and a hipster and go, I don't think I want gluten anymore, okay? Celiac disease is diagnosed early on in life. And that means that you cannot tolerate foods that contain gluten. If you don't have celiac disease, you need gluten, okay? Gluten is found in wheat and wheat products, okay? Wheat, barley, and oats, those kinds of things. Just know this, for celiac disease, the patient can only have things like corn, rice cakes rather, not corn, things with rice. Rice doesn't have gluten in it. So they have to avoid anything that is wheat, wheat product, oats, bran, barley, those all have gluten. Can't have them. And lactose intolerance, that means that lactose is the fat that's found in milk, and also there's a protein in there too. Diagnosed young typically as well. A patient will have severe diarrhea every time they take in a dairy product that contains lactose. If they're lactose intolerant, they can have yogurt, believe it or not, because the live cultures will help. They should not be taking in milk, even if they're a child. They'll take in either Lactaid, which is a type of milk where the lactose is removed, or they can get these lactose enzymes orally that allow them to drink small amounts of milk, because children and babies need milk for growth and development. That's all you need to know about those two. The end. Let's see. Not even going to get into those. I think that I am going to leave off this lecture right here where we are. Yeah, so I am going to stop at 68. And let me get back to Skype. And I'm going to stop the recording.